There's some questions to think about today. Obviously, the big one is this lockdown working? Another would be, how do we really know? I mean, if you don't test, you don't know. The cases we have are cases found by testing. The rolling average of testing is a bit over 2,000 in the past week. We have capacity now for over 5,000 a day. Why have we never got to our capacity is a fairly simple question, I would have thought, given every single epidemiologist going says we need to test more. If that's the case, why aren't we? Why are doctors and frontline health workers claiming they can't get testing kits and swabs and protective gear? How come the health department argue there isn't an issue when clearly there is? Other questions. If this lockdown is working, in other words, if we are flattening the curve, as they say, and we can expect 80 or 90 cases a day, then at what point can we start to move on the economy? Now, Australia too is flattening their curve, but they have left more of their economy open. The country simply can't afford. This is our country. We can't afford the $3.5 billion a week, which is the bill for this thing. An important number to remember as well is how many people die anyway. Now in this country, it is 7.6 per thousand. In other words, about 35,000 people die in this country per year. Now the alarm you're seeing offshore in places like Italy is false coverage to the extent that many of the people would have died anyway. They were dying anyway. It's a hard thing to say, but it's also true. It is a fact. Places like Spain, for example, have a death rate of 9.2 per thousand. Italy, it's over 10 per thousand. And in other words, in Spain, well in excess of 400,000 people die per year, over 1,100 people a day. If we ring those deaths up on scoreboards the way we are with this virus, we'd be alarmed. In Italy, it's over 600,000 people a year, over 1,600 a day. Now, the death toll you're seeing is not unique to COVID. There are very few, very few, who you could argue die specifically of the virus. In Italy, 99.2% die with underlying health issues. In other words, the very things that were killing them anyway, at over 1,600 a day. They die now with COVID, not of COVID. And the distinction is critical and yet barely reported. Further questions. This health stance at the expense of the economy was launched through a fear of our health service being overwhelmed. Currently, there is 50% capacity. It's about 1,000 beds in hospitals up and down this country at the moment. 1,000 beds lying empty, given all the elective surgery has been cancelled. And yet a handful of people actually need that space at the moment. Fewer than 20 people need that space at the moment, which the health advocates, if all goes well, will argue, well, better safe than sorry. Really? How sorry will we be as thousands face joblessness, we face debt for generations and an economy in recession for what turned out to be potentially not a single death that would not have occurred anyway. Hospitalisation that barely dented the sides, but a reaction, as one epidemiologist put it last week, that was a hammer to crush a flea.